Sir, should I start or somehow will?
Okay, go ahead. Start.
Hi all, good evening. I'm Dr. Shama Sultana, moderator of this section. I welcome you all on behalf of Sexual Medicine Committee to Masterclass series on psychosexual health. So far, 5 sessions have been completed. This is the 6th session, and session 6 is sex and gender. Before we start, a brief introduction on today's topic. For this, I would like to invite the person behind this all programs, Dr. Neeraj Jadhav sir, Chairperson, Sexual Medicine Committee, FOXY. At present, he is also Vice President, Menopausal Society, Rajkot. Over to you, sir.
Thank you, Samba. So, good evening, everyone. Thank you for joining this 6th session of our masterclass series that is on psychosexual health. And as told by Sama, this session, 6th session is on the sex and gender. Up till now, we have covered total 5 topics in the psychosexual series. First one was on communication, then censored focus, then CBT, then sex therapy, and our last session was on mindfulness. And this session is on sex and gender. So, before we start the program, let me wish you everyone, as you all know, 4th September is the World Sexual Health Day, and we from FOXY are celebrating in a big way. So I hope you also are doing your part in raising awareness about the topic. And today's this year theme for the World Sexual Health Day is consent, which is very important when it comes to the sex and sexuality. So I hope everyone who are attached some way or another in the sexual medicine are raising the awareness about the theme that is consent. So with this note, I welcome all of you once again, and I'm very eager to listen from our faculty, Dr. Rao sir, because this subject is, we know very little about the topic, that is sex and gender. So I'm also eager to learn about this topic. And so without wasting much time, we can proceed the further. So over to you, Sama.
Thank you, sir. So we shall start with our blessings from Chief Guest and Guest of Honor. Chief Guest, Dr. Prakash Trivedi, sir. He is yet to come, yet to join and bless our session. Now, Dr. Revati Jankiram ma'am is with us. She is a former director, IOG Chennai, and Vice President, FOXY South Zone 2016, and President, TNFOG. And she is founder, president of various societies. She has been recipient of numerous awards, from which Lifetime Achievement Award, IMA Madurai, and Pride of FOXY is one of those. And she's also been an author for many chapters in FOXY Focus Issues and UGPG books. Welcome to the session, ma'am. I would like to request you to bless the session with your words.
Thank you. Thank you very much for your kind introduction. Good evening, dear friends. First of all, I would like to congratulate Dr. Neeraj for organizing such important series of webinars on psychosexual health. Actually, such webinars sensitize the doctors, we gynecologists, about the prevalence as well as management of this important problem. They in turn, these doctors in turn, can create awareness among women as to how they can approach the healthcare providers for these issues without any hesitation. Many women, especially in the low and middle income group, never come out with their psychosexual problems at all, except few exceptions. Actually, a couple of days ago, one lady came to me post-menopausal, menopause 1.5 years ago. She was a very pretty lady, and she said she is unable to satisfy her husband. She went through Google and she asked for, madam, do something, either a vaginoplasty or mammoplasty, whatever you do. I want it, and I don't want to lose my husband. Another thing is that if you can't, at least you give some medicine to my husband to reduce his sex desire. Now, that is how people are. And some are coming with the problems also. But in the lower socioeconomic group, especially in the middle income group, rural areas, they never come out with these problems at all, which definitely needs some attention to improve the quality of life. And I'm sure today's topic on sex and gender is really going to be very interesting, and I'm very eager to listen to Dr. Rao. And definitely I wish, and I am sure that this will give a lot of insight on this area. And I wish this webinar a grand success and also success in every endeavor, in future endeavor for Dr. Neeraj Yadav. Thank you very much.
Thank you, madam. Yes, Sama.
So shall we go ahead with the PowerPoint, sir?
Yeah, share the PPT of the
Yes, sir.
competition detail. Yeah. So, dear friends, as 4th September is coming, we from the Foxy are celebrating in a big way. There is a competition for every Foxy member, that is poster and slogan competition. Today is the last day, so I hope by today night you will send the entry to the us. Details are mentioned in that. It can be either in Hindi or English, maximum 20 words. And we will declare the result for the poster and slogan competition in the 4th of the September Foxy program. Next one, Sama. On 3rd of the September, we have asked all society which are attached to the Foxy to arrange a rally, because we want to raise the awareness about the sexual health and the theme of this year, consent. So please make sure that you in your society level arrange a rally and send your details about what program you have done, some videos and the pictures also you send with that mail, and we will give best activity award to the 3 society which are the best according to our judges. So I hope you will take part in the that rally program also, which is a Foxy presidential initiative activity. Next one. And on the 4th of September, Foxy is organizing a very good event, that is a webinar where we have so many distinguished faculty with us. Chief guest is Dr. Prakash Kothari. Guest of honor is Dr. Samsul Ahmad, which is president of the South Asian Society of Sexual Medicine. And we have a panel on the topic of consent, which will be moderated by Dr. Narendra Malhotra sir, and so many distinguished faculty from the different branch, like IPS officer, NGO, social activist, our own stalwart from the Foxy member. They will discuss in depth about the concept of the theme, how what are the various aspects of the consent which applies to the when it comes to the sex and sexuality. We have also one talk by Dr. Salbia, which will be on the role of comprehensive sexual education in developing the healthy sexuality. So don't forget to log in on the 4th September. The program will start at the 6 p.m. So I hope you all will join that program also on the 4th September. So thank you. Sama, madam is there? Madhuri madam? Yes, Madhuri madam is there. You can invite Madhuri madam.
Welcome, ma'am, to this session, Masterclass Session 6. Dr. Madhuri Patel, ma'am, Secretary General, Foxy, please bless us to this session, ma'am.
Thank you, Shama, for your kind words, and Neeraj for your kind words. Respected our most dynamic and visionary president, Dr. Rishikesh Pai, our vice president in charge, Dr. Asha Bakshi, then today's chief guest, Dr. Prakash Trivedi, very good friend of mine, and he is mentor to me. Then guest of honor, Dr. Revati, again very good friend of mine, and Dr. Padma Shri Usha madam. You know, she is my mentor along with CN Purandare, and she always guides me. And of course, we have Dr. Neeraj as a chairperson, Dr. Apurba and Dr. Shama as a master of ceremony, and of course our speaker, Dr. TSS Rao. I have been hearing from Dr. TSS Rao since so many time in the master classes, and he's an excellent, speaker and the orator. And all my dear delegates, very good evening to all of you. At the outset, I would like to thank, Dr. Rishikesh, Dr. Asha Bakshi, and Dr. Neeraj for giving me this opportunity. And as we all are aware that Neeraj it was not the awareness program on sex and sexuality. Is very, very important. And Neeraj has been trying this since last 2.5 years. And I will say he is very, very successful in creating, sensitizing, aware, making our members aware about this problem. Because sexuality is really, really in our culture we don't talk very loud, and therefore this gives us the webinar gives us the information and awareness and sensitize all our members. And this we can talk openly. Nowadays the youngster, they come to us. Before that, nobody used to come to us. But nowadays, the youngster come with their problem. And, there is nothing is mentioned in the textbook, what are these sexual problem, what is it? It is still limited knowledge is there. So through this webinar, we are also getting updated our knowledge. And of course, we will implement this on our patients, so our patient will get benefit. So with this, I congratulate the team, Neeraj and Dr. Rishikesh Pai and Dr. Asha Bakshi, and of course, Shama and Apurva for the most apt webinar. And I wish them best for their future endeavors. Thank you once again for giving me this opportunity.
Thank you so much.
Thank you, Madhuri madam.
Thank you so much.
Asha Bakshi.
Asa madam is there, yeah.
Yes. Good evening, ma'am. I welcome Dr. Asha Bakshi, ma'am, Vice President Foxy, to Masterclass Session 6 of Psychosexual Health, to bless the session with your precious words, ma'am.
Thank you very much, Shama, for the kind introduction. And thank you, Madam Madhuri, for such kind words. And Neeraj, as usual, is on a go all the time. And today, the topic selected is really good. It's a very confusing topic, but I think a very apt topic in the modern times where people are getting so confused. And I think we also need some knowledge on this, because the parents come and they want us to talk about it. And I think unless we ourselves know, we can't talk much. So the topic by Dr. Rao is really very good. And I'm very glad that Dr. Prakash Trivedi has consented to be the chief guest today. So it's a matter of great honor. And thank you, Dr. Revati and Madam Usha Sharma for being here. And thank you, Madhuri Madam, for your kind words. Apurva, you are always active, and heartiest congratulations for the great.
Thank you so much, ma'am.
Yes,
Thank you,
your
ma'am.
sincerity really proved, and you got selected. That's really good, and heartiest congratulations. Thank you very much once again, and I think you can go ahead with the next session, full session.
Thank you, Asa madam.
Thank you, ma'am. Thank you so much, ma'am.
Yes, Sama.
Okay, thank you. So we shall go and start our much awaiting session. Dr. TSS Rao, sir, Professor, Department of Psychiatry, JSS Medical College. He is a past General Secretary, Indian Psychiatric Society, and he's an editor, and he had many publications and awards. And last sessions, 5 sessions, we have really mind-blowing sessions, and we have learned a lot, sir. And we are much awaiting to hear from you the session 6, sir. Over to you, sir.
Okay.
Neeraj?
Yes,
Neeraj,
madam.
before
Yes.
starting, you can call our chief guest and guest of honor before sir starts, I don't know what is your schedule.
Yeah. Trivedi sir is not picking up.
Are you able to see my
may be
screen?
busy in OT. So
I
he
can
will
see
do that.
Dr. Revati. I can see Dr.
Yeah,
Revati.
madam is already finished, madam.
Okay, so. Sorry, I was late.
Yes.
You could see my screen?
No, sir.
Do that? Okay. Ravi?
And Usha madam was told that there is a Rakhi today there, so she will be not joining.
No problem. No problem.
File. ಎಲ್ಲೋಯ್ತಿದು ಇಲ್ಲಿದೆ
Yes, visible.
Are you able to see?
Yes, sir. Minimize that
Okay,
side, side
Yeah.
window.
Right.
Okay, sir.
Okay. 1 minute. Okay. Good evening, everybody. And I'm extremely happy that again and again, I'm getting opportunity to interact with gynecologists. I'm married to gynecologist for 35 years, and it is invariably a pleasant interaction, meeting people who are involved with managing so many complicated problems. Sex is actually something which part and parcel of everybody's life. Extremely important aspect in gynecology, mainly because directly and indirectly it impinges on a range of activities. Whether you are talking about pregnancy, whether you are talking about infertility, and starting from young to old, they are the people who will be dealing with actually what we call sexual issues. Unfortunately, the knowledge related to the sexuality is very limited in many specialities. Possibly, if we just take out so many what we call as biases, the gynecologists are possibly the most enlightened people related to the sexuality. And the way Dr. Neeraj and the team is conducting so many programs, I think everybody is very thoroughly involved with this particular aspect. All said and done, there is something, the terminologies we use so commonly and so confusingly. Both the terms I am using because of the simple reason that we interchange, we mix up the concepts, we try to understand something as something giving total meaning. Many of these type of confusion leads to quite a bit of difficulties. So today's topic, I have divided into certain common terminologies, the meaning what we get out of it. The second point is actually if we try to look at why the gender becomes certain things important in the usual course, developmentally speaking, that means there are few things which can interfere. From psychiatrist perspective, I believe there are only about 3 significant major syndromes we should be well aware of, which I will come across in due course. The third point is, now the whole range of issues related to, you talk about societal, you talk about legal forensic issues, you talk about the progress and civilization, the way it is going on, the whole range of gender issues. What is that gender? What is that gender issues? I'll come 1 minute later, but all said and done, you might have heard of the third gender, which has been approved and accepted as something important. And one of the legal decision related to that, which I come a little later. What I am trying to convey at the introductory level is, there are many terms, so much of confusion is there. We need to be aware of what all these actually the terminologies and what we mean by that. There are issues related to what we basically call identity, orientation, and each of these things, what it actually means. I'll come again 1 or 2 few minutes later. Of course, we are all well aware the September 4th is International Sexual Health Day. And from our department, so also the SASAM School India, which is there in Mysore, along with JSS Academy of Higher Education and Research, we are conducting intensive clinical skills training program and International Awareness Day at our Rajendra Auditorium and at Hotel Sipai, which is on the MG Road in Mysore. And there are 2 more days left for that, and whoever would like to join, most welcome. And it is actually a physical program. We have tried to see that. In fact, the people who are being trained to some extent, they should have a practical knowledge, and from that particular angle, we are working out that particular activity. So coming to the today's discussion, sex. sex is actually extremely important. You all might have heard of this particular terminology. I still remember a lady who came to our department, and she was supposed to fill up an application. In fact, she wrote everything, and for a little while she was worried about completing the application. She was scratching her head and with her pen, and a little while later she left the application. When I read it, there was a column, name, age, sex. She had written 3 times per week. So that means many people get confused with this particular terminology. And when you are talking to maybe a sexologist or the department which actually deals with that, people will get confused with sometimes equal to something like physical activity. But it is a very broad terminology. I'll come to that point 1 minute later. When we are talking about that application and the terminology used, sex, here we are trying to look at an individual, what he considers himself, a male or female. That means how you decide about male or female. In fact, men carry certain specific organs and certain features which actually says that they are male. And the female carries certain particular features and structures which actually says, primarily, this is actually the phenotypic expression. There are chromosomes, and ultimately we actually manifest either male as female. And this particular terminology is easily to understandable. When we use the term gender, the meaning here is actually socially constructed characteristics of men and women. That means it is not just the physical features, but there is a lot more. That means the whole range of social, cultural, behavioral characteristics get into this picture. What it means is, in every society and in every culture, there are certain norms. Each sex is supposed to carry out certain roles, and actually he establishes relationship between himself and the other person. It may be the friendship, it may be the marital relationship, it may be the sexual relationship, whatever it is. So gender is a little broader terminology compared to sex. What it means is there are so many other related activities get into this picture. And one of the equivalent terminology, male and female, what I told phenotypically, yes. When you are trying to talk about gender, it is actually the maleness and femaleness what we are trying to talk. That means he is supposed to behave some particular way. She is supposed to deal in some particular fashion. So this is actually the exact meaning. How and why it happens, the whole range of things are there. I still remember my wife is gynecologist. In one of the cases delivered, the nurse was carrying this particular baby, and she brought it and gave it to this villager. In fact, he told, "Oh, I'm very happy, but it's a male baby." Then sister was telling, "No, it is my fingers what you are touching." What it means is, we assign a particular baby, male or female, based on certain particular characteristics. This initial assignment as male or female is going to make significant impact. And this happens usually at birth. And you as a doctor, you have declared that particular lady, she has delivered a male boy, a female girl, or whatever it is. Gender role is actually a little additional connotations it actually carries. What it means is, it is socially ascribed characteristics and expectations associated with being male or female in a particular culture. This is what actually the terminology, male, female, maleness and femaleness. Here we are talking about masculinity and femininity. That means each individual is supposed to carry out certain particular way, certain activities. So this is what we precisely call the role an individual plays. Variable between cultures and over time. In fact, if you would go to certain Western countries, so difficult. I have traveled to China. Almost everybody looks same. In fact, there is one of the joke that the person talking to a person, I'm so happy I met you. Then she says, whom you are talking, he is somewhere there. So both male and female may look similar for so many ways, may be difficult to actually differentiate in some cultures. So it is variable between cultures and over time. It is complicated because they are distillate of what it means to be. in each culture, they attribute certain particular characteristics, whether it is present. So we have tried to understand words, sex, gender. Gender assignment means what? Gender role. Here, the issues become a little more complicated, not because of anything, but because the real man, real woman, and many such things. In fact, you might have noticed when two people are fighting, are you a man, are you a woman, various other such terminologies people try to use. What it means is you actually add a lot of value to some of this particular terminology. How do we think sex? What we have been brought up and what science has told us in the beginning, at least what we read minimal, we were aware that there is a category called as females and there is a category called as males. And this was actually what is referred to as binary definition of gender. Either they are male or females. Unfortunately, the life never goes in that particular fashion. There are a whole lot of things. There are only two sexes. Sex is binary is one of the very old concept. All people must be assigned to one sex. This is what actually we have been taught. Sex assignment is fixed and stable over life course. Sex characteristics and gender experience are congruent. There is one real sex. So these are all the few of the old hat ideas which were there. And now the world has moved so fast and so much that almost many of these type of things are actually being questioned. And when we are trying to look at this particular concept, this particular triangle, when we are dealing with these issues, what we have to remember is actually sex as one corner, the behaviors what we present, and the gender. So gender identity. Gender identity refers to what I feel I am. I may think I am male, I may think I am female, and so this particular way. Behavior refers to the role, expression, and what all actually I am trying to perform. Sex, in fact, the phenotypical what we actually mentioned, and there are some particular specific characteristics which actually go with that. And the physical appearance actually determines. That means when we are trying to look at this particular concept of sex and gender, there are so many complicated ideas which are there. And being aware of what actually each one means is actually one of the very important aspect. So another way I'll try to look into, there are so many other particular characteristics there. When we are talking about sex, male and female, the genotype means actually we carry certain types of chromosomes. Say, we are all well aware, X and Y determines whether somebody is a male or female, two X's and one X and Y, in fact, what it is. And ultimately, you get some particular thing. Maleness and femaleness, gender role, various things actually what we have spoken. To elaborate a little more, the thoughts, feelings, behaviors of males and females, expectable and appropriate, are specific to one's socio-cultural environment. That means something which is socially acceptable. I still remember one of the patient was brought by a lady, and this fellow was wearing a very pink color dress. Mother was upset, and whatever she was trying to convince him, he was not willing to change, and he was wearing that, and he has come to the hospital also with that. Then she was explaining, this is the petticoat material brought for her daughter, but this fellow has stitched the shirt. The only important point of differentiation was actually this was a pink color dress. So mother was so much upset that why this particular fellow is trying to wear this color dress. And if it go west, in fact, we feel suddenly flabbergasted with so many of changes that actually have happened. Many old people, in fact, they want to come back to our own culture and a whole lot of things, mainly because they can't manage or understand or deal with the way actually the society is trying to change. So coming to some of this concept, what I had mentioned in the triangle, gender identity. It is a component of self-concept. In fact, one of the scientists who had done a lot of work in this particular field is John Money. We should remember his person, for the simple reason that, in fact, man and woman were clear, distinct, and there is nothing like, say, 50-50. Each one is actually something special and actually complete on its own right. It is a self-concept. subjective recognition of belonging to a particular group, irrespective of biological sex. Example, sexual organs they possess. Transsexual is one of the very frequently used terminologies, and I'm going to repeat this particular terms at least about 3 to 4 different times in the different contexts. When you use the word transsexual, it's a paradigmatic metaphor which indicates that man feels or woman feels that they are trapped in the wrong body. I have all the features, specifically characteristics, which actually we call man or a boy. But it is not possible that I feel that particular way. Just 1 minute only. Within it. 31 minus 20. Very good. So, individual is having certain characteristics, but actually it is what he believes is actually something totally different. All the characteristics may be indicators of what we call as the male, but he feels he would have been better off as female. She has all the characteristics of a female, but she feels she would have been better off as male. And just like what happened for homosexuality, say in 1973, the American Psychiatric Association removed homosexuality as an abnormality. They are like anybody else. But one of the concepts of the time, we used to use what is called as ego dystonic, ego syntonic. That means somebody is comfortable, somebody is not comfortable. And those concepts were actually pretty vague, and in fact, a whole lot of confusion was actually getting into this. The DSM-5 currently talks about terminology called as gender dysphoria. This is at the introductory level what I'm talking. It is a general descriptive term, refers to individuals' affective and cognitive discontent with the assigned gender. He feels uncomfortable about what actually he is having and what actually he feels. So, in DSM-5 refers to distress that may accompany incongruence between one's experience or expressed gender and one's assigned gender. He has been told he is a man, but actually he feels he is actually a female. She has been told she is actually female, but she feels that she is actually a boy. So there are lot many terminologies are there. I just focus there, and later only when the question comes, we'll try to answer. And many of these type of terminologies, in fact, we are going to elaborate as we proceed. Transgendered, transsexual, trans man, trans woman, pangendered, cross-dresser, drag king. In fact, the number of terminologies which are there, in fact, it roughly runs around 100 plus. These are all very frequently used terminologies, and each one actually may be actually having certain particular specific meaning. We'll come to that point later. There is another way of looking at actually the sexual development and differentiation. Primary sex characteristics indicate the genital information. Secondary sex characteristics indicate body hair, breast development, etc., and which adds to the particular primary sex characteristics. Neuronal functions, neuronal information which is there. Body features, chromosomes, gonads, sex hormones, each one has a very significant role to play in actually what individual believes. See, one important aspect what one should remember is actually we all started our life as females only. Maybe somewhere around that genital bud, 11th, 12th week, differentiation starts happening. If there is actually fusion because of certain particular specific hormones and certain specific surface enzymes, SRY and various other things what we talked about, it becomes something like male. If there is no such a change, in fact, it works out to be female as it stays. And there was a small cartoon film was there. The point is, both male and female. In fact, we started on particular way and we carry on some particular way because of the whole range of developmental issues that happen. We need to understand few important intersex conditions which can actually create problems. See, we are talking about chromosomal level. In fact, you are all gynecologists and it may become too superfluous, but only to complete the process. We are all heard of terms like Klinefelter syndrome, Turner syndrome, states where an individual sex chromosomes, genitalia, and our secondary sex characteristics are neither exclusively male nor female. The phenotypical gross changes happen because of what we basically call chromosomal abnormalities. In fact, there is a whole data available, how common it is and all of that. We'll not go into too many details. Hermaphroditism actually one of the terminology used. And I'm going to elaborate for about maybe 2 to 3 minutes. There are 3 syndromes what we actually need to remember at this particular level. What is called as androgen insensitivity syndrome, congenital virilizing adrenal hyperplasia, and hermaphroditism, and more particularly, in fact, they're all grouped under what we call as pseudo-hermaphroditism. The true hermaphroditism is actually very rare, but pseudo-hermaphroditism is actually extremely common. And this series of diagrams from one of the books talks very clearly. This is only the differentiation between how much that has happened, which ultimately makes. But somewhere in between, it may be so confusing that one boy or girl may be interpreted in a particular fashion, which may not actually be the truth. But all these conditions are put under what the great terminology called as intersex. In fact, recently, one of the chapters we have contributed is related to this whole range of intersex conditions. And this is not the class meant for that intersex related conditions for a very great detailed elaboration. That itself is a very big subject matter and can go run for hours together. When you are trying to talk about hermaphroditism, one important point what we have to remember is actually that both ovarian and testicular tissues are present. In fact, son of Hermes and Aphrodite, in fact, the whole story runs in that particular fashion. And both the structures are present. This is actually supposed to be not so common condition actually. And this is actually just taken from the Google, what talks about Aphrodite and Hermes, the characteristic because of which this particular name came. We are all well aware of the Venus and other related stories and all of that. I'll not go into too many elaborate description. Now, nowadays I'm talking much more in detail about intimacy and lot many other such related issues. That's where many of these type of things get into the picture. When we are trying to talk about hermaphroditism, this is rare. Born with both ovarian and testicular tissue, one gonad of each type or combination of tissues, internal sexual anatomy confusing. Sometimes both the tissues are developed. And when we are trying to use the terminology pseudo-hermaphroditism, there is abnormality in sexual differentiation and mismatch between individual genetic sex and development and appearance of external genital. One of the very characteristic example is actually fetal androgenized male. Extremely common in gynecological practice because when fetus in trouble, what we basically call, to protect it, to sustain it, you are likely to use a range of hormones to sustain it. When they metabolize, how precisely and to what extent certain changes can happen. Ultimately, in fact, one can have certain types of changes. One classic group of syndromes in this particular group is actually androgen insensitivity or testicular feminization syndrome. It is an X-linked trait, normal breasts but no sexual hair, normal looking female external genitalia, absent uterus and upper vagina, karyotype 46 and XY, male range testosterone level. So these are few of the things, and I will not elaborate because this is not my area of specialization. So androgen insensitivity syndrome, complete and partial. Based on that, in fact, the whole range of developmental confusion can set in the sense that, in fact, they are not so well developed and people can interpret in one way or other. So congenital adrenal hyperplasia is another condition wherein the clitoris looks bigger, and people may again get confused this particular aspect with what we basically call the very commonly administered. Absence of 5-alpha reductase and that deficiency to some extent can lead to, again, female or ambiguous external genitalia and to male external genitalia. And this is another condition. DST deficiency males extremely commonly reported in certain places in the world. And in fact, we also reported nearly one case wherein, in fact, the child brought up in a particular fashion later recognized that actually not so, and based on the certain characteristics. This was in the media for a pretty long time, and how precisely, in fact, one recognized earlier as the girl and then subsequently as the boy. Many of the times this is extremely common, and it is actually easy to adjust compared to brought up as a male and then recognized as female can lead to quite a bit of more difficulties related to this. Self-awareness of one, so maleness and femaleness is what to talk about identity. There is a match and mismatch, actually, what we have already spoken. There are other one or two small important points, actually, let me just elaborate. See, if you try to look at some popular figures, in fact, these are all our celebrities and heroes, whether to say the real man, real woman, or in between they are, actually, in fact, it is so difficult. In fact, they have left the mark, but all said and done, it is so difficult to actually differentiate from one from the other. Transsexuality, condition in which a person feels trapped in the body of opposite sex, what we spoke about. In fact, this is one of the classic example of Bruce Jenner. Later, when he underwent surgery and all of that, in fact, now call me Caitlin. In fact, this is was there in the newspaper for a pretty long time. We have heard of many of these type of things in the popular press. So what are these terms? Transgender is a gender term used to refer to those who identify with a gender different from the one they are born with. So I'm trying to simplify the definition. Genderqueer are those who feel they are between genders of both genders or neither gender. Cross-dressers who wear clothing traditionally associated with another gender, but who maintain a gender identity that is the same as their birth-assigned gender, known as cross-dressers. Of course, this is one of the photographs I have taken with this Bharatanatyam dancer. In fact, he is actually a male, but in fact, more than female. In fact, what I can say, the behaviors and all majority of those type of things, actually, the individual was presenting. I'm just putting up 3 small videos to bring to your focus how actually one can differentiate. We have seen a lot of movies, Chachi 420, Jai Lalita, and Mrs. Doubtfire.
My marriage is not ending, it's just on hiatus.
To put his family back together, Daniel Hillard needed a job.
Do you have any special skills?
I do voices.
Yeah. Nancy and I are still looking for the other half of my head.
Look at me right now, Moneypenny. Want to undo that bow and get to know you.
Mr. Hillard, do you consider yourself humorous?
I used to.
And a decent home for his kids.
How do you like it?
Can't you just tell Mom I'm sorry?
But he found a way.
I'm placing an ad for a housekeeper.
Housekeeper? Would you make me a woman?
To have both.
Wow.
No. You for tonight, Doubtfire. Papa's got a brand new bag.
He's still the same old dad, only better.
Dinner is served, madam. You must have met man's eyes.
Accent's a little kind of muddled there.
Really? Well, so's your time.
The terrorists they ran that way. It was a run by fruiting.
This holiday season,
Surprise.
Robin Williams, Sally Field.
Who needs a husband when I've got you?
In a Chris Columbus film, Mrs. Doubtfire.
It's not here.
A father's work is never done.
Oh, first here's a woman. I'm getting hot flashes.
We have, what we could recognize here is that where the job necessary and something available which was meant for the ladies, and a person can actually do certain things to mask himself. What is that actually will come 1 minute later.
First time we met, she oppositioned me. She seemed so sure.
I was sure. It was so shy and mysterious. Is there something you'd like to tell me?
Just something you'd like to know.
I'm your wife. I know everything. Could you help me with something?
You will not tell anyone about this.
Hello there. I'm going to call you Lily. I want to sketch you. Lily. We should go out tonight. Give them something different. Lily. You're exquisite.
You're different from most girls. I feel I'd need to ask your permission before I kissed you.
There was a moment when I wasn't me. There was a moment when I was just...
But Lily does make sense. We were playing a game.
Something changed.
He's lost his way. He needs a friend.
Yeah. In Lily's thoughts. I dream her dreams. She was always there.
I need my husband. I need to hold my husband.
Please. I believe I'm a woman.
And I believe in you.
Surgery has never been attempted before.
You're my whole life. I could kill you.
It's my only hope. This is not my way. I have to. Of you. Because you're the only person who made sense of me. Who made me possible.
You might have noticed that in this second movie clip, here the individual realizes at one particular point that he is meant to be something different. In the earlier one, it is actually the occasion or the necessity which actually dealt. In fact, in the classical term, which we are going to elaborate a little later, this is what actually referred to as what we basically call transvestite, wearing the dress of the opposite gender, and many other such other things. The second clip actually what it shows is actually the issues related to what we basically call the gender-related aspect. Gender role denotes a set of behavioral norms associated with the gender status in a given social group. Culture is bound and fluid, often depending upon the social economic circumstances. There is a significant variation between different cultures, and there was what we actually mentioned. In the beginning, I had mentioned it is actually people believe binary, that means either male or female. But things have changed so much that time to time in certain cultures, it is very difficult to make out how things are going on. Identity is established by third year. That's what actually the science says.
Sorry for the interruption for your day. I am not on welfare and I don't do drugs and I do not have any children that I know of. But I'm also not here asking you for money today. I actually am looking for somebody who will marry me so I can stay in United States of America because I love America. Maybe somebody will marry me so I can stay in America. I am a good husband. I can be good husband for you. I like to cook really healthy food. I'm very, very clean. I know how to give massage. I'm a happy person and I like to listen to really good Vladislava music, which is happy dancing music. So if somebody is wanting to marry me, I will be very, very happy. I do not need your money. I can even give you my money and you can use my money and you can buy clothing, nice clothing for you, even nice shoes. Anybody? Anybody wanting to marry me? And now it's legal to marry men also. So men or women. It does not matter. I am equal opportunity lover.
This is what precisely happening. In fact, the world is changing so much. In fact, two couples traveling, can we exchange our selves? What do you say? We switch partners and ultimately landing up with same-sex partners. So such cartoons and a whole lot of these things are not in the realm of what we call as the dream. In many of the societies, this has become norm. And there are a whole lot of explanations, philosophical to, in fact, scientific, why it is happening, what is happening, and what will happen in the due course. But as we know at this particular level, in all societies, there is a set of gender categories that can serve as the basis of the formation of social identity. Some individuals do not identify with the gender assigned to their biological sex. This is in most societies, the basic division between gender attributes assigned to males and females exists. And in some societies, membership of categories is open to people regardless of biological sex. Third genders exist. Surgical hormonal treatment is employed to bring people's biological characteristics in line with their gender identity. This all depends upon which country, which culture actually you are, and a whole lot of such these things actually one can find. There is another terminology, sexual dimorphism. I am using some of these type of things just to bring to the focus. When you are using the word gender and very specifically gender dysphoria, I would have presented it in a different fashion. But there are a lot of other things which are actually present. In fact, one important point which has been documented is, if a man wears the female dress, everybody becomes suspicious. If a woman wears a man's dress, nobody bothers at all about it. In fact, one of the things is, so much of the rules and regulations are related to some particular issue. So the appearance and gender presentation rely on much more than sexual dimorphism. We manipulate our appearance in many ways, in many cultures, for many reasons, and have done so for millennia. What constitutes a feminine or masculine appearance is culturally bound and fluid. Clothes, makeup, hair, surgery, piercings, scarification, gestures, you name any number. In fact, in certain management, social journals, and when we are dealing with certain type of these things, people use the terminology called metrosexual, retrosexual, ubersexual, and many other such terminologies. Metrosexual is one actually, in fact, is very typical. In fact, this is one of these corporate, well-dressed male you might be seeing. Nowadays, males are spending so much of time on makeup. In fact, unisex salons have come. Men undergo the whole range of facials to cutting nails to, in fact, you name anything what actually you women were trying to do. All these things indicate, in fact, there is a certain particular value attributed to certain particular way the individual looks. In fact, these people are referred to as metrosexuals. I still remember when we were doing our college days, you take bath and you dress well and go to the college, but the girls will be talking to a fellow who is wearing this haggard jeans pant, not taken bath, and he washes jeans once a year and not shaven, and rough and tough motorbike ride. How many of us must have felt bad that you are so well but dressed, but this other fellow who is not that well, but girls attracted to them? Reasons could be many. In fact, at one particular time, when we were talking about pheromones and all of that, you take bath, that means you are washing off pheromones. You don't take bath means, in fact, the pheromones are there and which may be actually capable of attracting. In fact, these are all called as retrosexual. In fact, this is another way of classifying. Metrosexual, retrosexual, based on range of characteristics, actually, what they present. This Bahubali movie and all you must have seen. Man who exhibits traditional masculine qualities, as well as the caring nature of the new man. In fact, one of the classic example, the Ashoka movie you might have seen, or Bahubali and all of that. In fact, many of these heroes are depicted without shirts on, you might have noticed. Ultimately, to document that from both angles, what we basically call highly muscular and strong man, Superman, to, in fact, these are all very caring and, in fact, the people who actually work out to be something like, in fact, the woman lie. So they are called as uber-sexual. Like that way, there are multiple terms are there, we'll not go into. Let us come into what we basically call how these particular concepts are developed. ICD-10, ICD-11 is there now in vogue. In fact, in ICD-8, sexual deviations separated from the personality disorders. The new entity transmission was included in the sexual deviations. In ICD-9 in 1975, transvestism was replaced by transvestism. Defined as sexual deviation in which the sexual pleasure is derived from dressing in the clothes of opposite sex. There is no consistent attempt to take on the identity or behavior of the opposite sex. So there are two terms that came into being at that particular time, subsequently in ICD-10, transvestism and transsexualism. There is another one, you might have noticed also there is something called as fetishism. In fact, the attraction is towards an inanimate object. It could be slipper, it could be undergarment, it could be anything for that matter. In fact, this is one of the cases who presented to me, who had, in fact, a wife, got married, and then subsequently she was very happy with him because he used to wear sari much better than what she was able to wear. He was very comfortable, and in fact, she was feeling very happy because she has come across a man of her nature. In fact, he was so efficient and proficient in wearing sari that, in fact, even he used to help her actually how to wear. In fact, fetishistic transvestism, because sometimes fetishism and transvestism, difficulty, there is differentiation, and it could be together sometimes. So this is the classification what actually came into being. Transsexualism at that particular time, what was used was referring to, I am trapped in the wrong body. This is what actually we have already mentioned to you in the beginning. Fetishistic transvestism, this is what actually I was trying to mention. Disorder of sexual preference, not gender identity. Goal is obtaining sexual excitement through creating the appearance of a person of the opposite sex. Clear association with sexual arousal, but this is not meant for sexual intercourse. There is a strong desire to remove the clothing once the orgasm occurs and sexual arousal declines. It can occur as an earlier phase in the development of transsexualism. When you are using the word transsexualism, there is a sense of discomfort with or inappropriate of one's autonomic sex, and he wished to have surgery or hormonal treatment to make one's body as congruent as possible with one's preferred sex. The transsexual identity has been present persistently for at least 2 years to make a diagnosis, and the disorder is not a symptom of another mental disorder, or is it associated with chromosomal abnormality. So when you are trying to look at international classification, ICD-11 has come out with a newer terminology, what is called as gender incongruence. Same, when we are trying to talk about transsexualism, this is that in tune with actually DSM classification, is considered as a natural variation. Diagnostic is clinical relevant distress or impairment that might result from gender incongruence, not gender experience or expression per se. A separate chapter for sexual disorder is another new development that happened in ICD-11. I just wanted to bring to your focus that particular point. Coming to DSM classification, this is American Psychiatric Association based. In DSM-5, it talks about gender dysphoria, gender identity disorder in children, gender dysphoria in adolescents and adults, gender dysphoria in children. In fact, these are the few of the things which were actually proposed earlier. But now, this depathologization, what was actually happening with homosexuality, has happened with this particular concept too. What it means is, Now we don't consider somebody believes that he's trapped in the wrong body, that this is actually abnormal, unless he's so distressed that he wants particular changes to come about. So what is this dysphoria? As the terminology itself indicates, a sort of unhappiness with one's biological sex. Concerns, uncertainties, and questions about gender identity persist during a person's development, become so intense as to seem to be the most important aspect of a person's life, and prevent the establishment of relatively unconflicted gender identity. Varying degrees of dissatisfaction. Controversy exists because viewing gender identity as a problematic and the associated medicalization and trans identities. And this is what actually, in fact, people have tried to imagine these individuals to change their identity for various reasons, starting from certain drugs to ECT to shock treatments to lot many other things. The whole idea was actually that it was believed at one particular time that it is possible to change that way. Now, it is considered as almost not done. Law doesn't just permit it all. How it is will come 1 minute later. Transsexualism is not a mental disorder anymore. Transsexual identity has not been treated by itself. Multi-professional treatment is needed to reduce the gender dysphoria. A person is either transsexual or not. There are more than 2 possibilities. Being in need to modify sex characteristics, and sex and gender are considered pluralistic categories, not binary. A man who feels like a woman is a transsexual man. A woman who feels like a man is a transsexual woman. No, you are understanding? There is another next type. A person with a male sex assigned at birth, experiencing as a woman is transgender woman. And a person with a female sex assigned at birth, experiencing as a man is a transgender man. So, sexual and gender, the differentiation is related to the behaviors, actually the individual presence. The gender experience is crucial, not the body. A transsexual person is normosexual oriented with regard to the biological sex. I'll not go into too many details. What it means is to whom we get attracted and all of that. In fact, what's referred to as orientation. One could be androphilic, one could be gynephilic, gynandrophilic, ambiphilic, somebody could be asexual. Whole range of such things are possible. What it means is what we are and what we are getting attracted to can make world of difference actually in one's life. All individuals diagnosed with transsexualism ask for hormonal treatment. Not really. Mental health professionals have to find out if applicants are true transsexuals or not. Sex hormones and genital reconstruction surgery are no longer 2 steps of a linear process to change sex, but are 2 different treatment options on their own right. Clients no longer necessarily need surgery to live and be recognized in the experienced gender. In fact, about that, I'll come 1 or 2 minutes later, how we go about prevalence of sex ratios and all those type of things. In fact, the data from our country is so limited, hardly anything worthwhile things there, but much of the data is from the Western countries. Both male and female people are documented. And these figures, how much to believe and all that, I'll leave it to you, and I will not spend too much of time on this particular aspect. What actually happens, because actually the individual believes he is actually something totally different than what actually has been assigned, this can produce depression. It can be one of the source for other mental illnesses. Suicidalities have been reported. Deliberate self-harm, alcohol and substance misuse, educational underperformance, crime victim, in fact, transphobic behaviors, and a whole range of these things. In fact, you all might have noticed Afghanistan, when Taliban took over, in the beginning, in fact, homosexual taken to the top floor and thrown from there, and all those type of things actually people try to do. It could be actually personality disorders. Inclusion of gender dysphoria in DSM-5 presumes to view transgender people from the perspective of psychopathology. It is important to note that gender nonconformity is not in itself a mental disorder. The critical element of gender dysphoria is the presence of clinically significant distress associated with the condition. So this is to emphasize the point. I have quoted this particular terminology again. again, clinically significant distress or impairment is present, then we call it as gender dysphoria. Coming to etiology, there are a range of biological factors people have used. The maleness and masculinity depend on the fetal and perinatal androgens. Testosterone make a significant role in determining. Estrogen can decrease libido and aggressiveness in men. Masculinity, femininity, and genderity result more from postnatal life events. So these are the few of the things. Genetically, gene variants, faulty androgen receptor genes, whole lot of such things actually, in fact, the data is available. Role of hormones. Many gender dysphorics take opposite sex hormones as part of their treatment, but little is known effects on this process. What evidence there is not indicative of any substantial difference that it can bring about. We are all well aware, we are all growing, and there is a wide differentiation. Though the girl matures maybe 2 or 3 or 4 years earlier than boys, the sexual interest and activity is much more reported in case of males than actually in case of females. The Dominion Republic, that hormone deficiency, which actually people, in fact, recognized early to be something and later turned out to be something, which we had mentioned a few minutes earlier. They're all studies to indicate that there could be some biological factors which actually there. Nature actually comes into the picture because everything may be normal, but subsequently the genes are different. This is the same story which applies. In fact, if you try to look at testosterone levels in certain individuals, absolutely normal, but he is not able to perform sex. And when the court asks us to actually evaluate, hardly anything abnormality. And this is one of the reasons we very strongly suggest that never give an idea that he is a fully functional male or female and all of that. What we need to give is actually, as I am trying to find range of things, I don't find anything specific which interferes with. That means double negative is actually one of the terminologies people suggest that we should do. So there are a whole range of biological theories to explain. There are a range of psychological theories to explain why this particular type of gender-related incongruence, the whole lot of things can happen. Children usually develop a gender identity consonant with their sex of rearing. The formation of gender identity is influenced by the interaction of children's temperament and parents' qualities and attitudes. In fact, sex role stereotypes or beliefs and characteristics actually we carry. And this leading to a lot of, in fact, mother-in-law doesn't like me wearing the salawar kameez. In fact, these are all at village level. Though world has changed so much, even at that particular level, at a very simple aspect, in fact, people may be talking about. Sigmund Freud and his whole range of contributions. In fact, one of the points what Sigmund Freud mentioned was homosexuality as the key. Where we all started life in that particular fashion. But where and how actually a whole range of psychodynamic aspects come into the picture. In fact, one of the things, whether you're talking about sexual jealousy, you're talking about paranoid formulation, and many other such things. In fact, homosexuality is, in fact, he is actually in love with me. But I feel uncomfortable. My mind actually formulates certain ideas. He is not in love with me. It may stop at that level, but many of the times it doesn't stop. He is not only, in fact, he suspects me. In fact, he wants to kill me. He wants to harm me. But that's what leads to the paranoid formulation. Ultimately, Freud believed that, in fact, homosexuality is one of the key important. And we are all also well aware of Marshall-Johnson's and Kinsey's classification of homosexuality, the complete significantly total homosexual behavior to heterosexual, and in between the 7 major categories wherein, in fact, one is more and one is less. This type of things can happen. Social learning theories, in fact, the Skinner, Bandura, and a lot of other people have done a lot of such things, reported that lack of stereotypical male role models can lead to, in fact, absent of father, in fact, only single mother bringing up children. The issues and such other things have been actually emphasized that modeling which is necessary in a child may actually miss at some particular level. So there are multiple terms are there. LGBT, one of the very commonly used terminology earlier. Then we talk about men having sex with men, women having sex with women. In fact, homosexuality, gay and lesbian. Then subsequently, it was a whole range of special groups and multiple permutation combinations actually came into being. How we assess? In fact, one has to spend a lot of time understanding early life experiences, gender development, maturation, sexuality issues, relationship issues, education and employment. And we also have to collect adequate history related to the medical, psychiatric, social, spiritual, body image, exploration and aspects related to that, and current mental status examination. Important, and this leads to a proper diagnosis. Technically a medical task, but input from others is essential for this. So body gender expression, gender experience, incongruence leading to distress, what we call gender dysphoria, cultural and psychosocial factors, which are actually part of this particular whole thing. National Institute of Mental Health and Neurosciences has come out with a manual on mental health care of transgendered persons in India. This booklet talks in great detail about how one should go about. This is in the public domain and very easy actually to get this thing. So coming to the treatment guidelines, how one should go about, whether actually these people need to be treated. Create a supportive environment and determine purpose of the visit. Assessment of dysphoria and related concerns. Mental stability. And this is why WPATH talks about at least 2 psychiatrists have to certify, of which one should be a government gazetted doctor. Education regarding treatment options and advocating for support. Responsible for integrated services. Determine eligibility and readiness. Completion of psychosocial assessment. Documentation of, in fact, a whole range of investigative processes. Provision for collaborative services, and be available to educate employers, schools, and institutions to remove the stigma related to this. And one of the things, in fact, one may feel, I am like this, I want to change and I want to be something different. These are all possible. Hypothetically speaking, anybody can have certain ideas, but actual real life, see, for example, even when surgery is indicated, everything won't go according to the plan and a whole lot of things can get into difficulty. So real life experience, that means spending at least for about a month, 3 months, 6 months, there are a whole lot of such concepts are there. But this has become nowadays an outdated concept. A commitment to the real life experience has been considered as essential for medical treatments in the past. A trans person is expected to live in their preferred gender role for a period of time before surgery. Allows time to realize the full and sometimes unexpected consequences of gender transition and demonstrates an ability to function. The intention is to reduce the incidence of post-treatment regret, but evidence for this is lacking. The process of changing gender. In fact, in one of those Danish Girl, that movie, coming out process, that means recognizing and realizing I'm actually something different than what actually I am actually going through. Telling this to family, friends, and employees. Socially and legally, the changes that need to be brought about. Asking others to use the appropriate pronouns, changing name and gender on official documents, adapting to changes in personal relationships and sexual functioning, bringing outward appearance in line with internal feelings. I'm going to talk very briefly about what all the things can be done and issues related to that. So, potential negative consequences related to the change people have documented. That means with the relationship, family, health, housing. In fact, you name him. In fact, people get into quite a bit of difficulty. Many people look at these people with a whole range of negative stigmatized fashion. 46% of trans people had experienced harassment. 73% has experienced some form of harassment in public. Hate crime research found that nearly a third of hate crimes occur outside the victim's home and 20% incidents involve neighbors because they believe that they are actually not normal. Potential positive consequences, but a lot of things can improve. The same story with COVID, what was actually happening. In some individuals, they were together and in fact, people felt very happy and they realized that in fact, a partner is such a nice person. Being together, in fact, many people realized there were so many negative aspects and in fact, this led to, in fact, divorce and such related things. So there are both negative and positive consequences to everything. Somatic interventions when sex hormones and there can be used to change the body parts and look and appearance and a whole lot of these things to reduce individual gender dysphoria. And in the long run, how it actually going to work out, we are not very clear. In fact, WPATH, World Professional Association for Transgender Health, has come out with a whole range of guidelines related to provide professional guidance for psychiatric, psychological, medical, and surgical management, minimum standards that should be met for carrying out certain procedures, open to local interpretation and implementation. A new edition in the last 6 months. National guidelines, we have to corroborate with that and try to, because legally speaking, the local laws actually hold good, aim to provide equivalent care across England, this is actually, but could be any other country. Consensus has not been reached. There is a paucity of evidence. So this is the, in general, what all the things that could be done as far as the gender-related problems when somebody presents to a clinic. Counseling, human genetics, hormone therapies, counseling related to the hair removal and changes and other related things, including surgery. Cross-gender hormones have a whole lot of issues. In fact, estrogens, if we are trying to talk about, I am not going to elaborate much on this actually because I'm talking to the gynecologist, I'm well aware. Whole range of these hormones are given to modify a man to a woman. The issues involved with this could be many. Side effects of estrogens, we are all well aware. We used to talk men in general about women and how actually so difficult it is actually to handle them, various such these things. But we are all well aware. In fact, a man pumped with estrogens can really present with many features and characteristics. In fact, you try to look at one of the classical example is migraine and such other things. These are all related to the estrogen and other related phenomena. Serious complications related to the estrogen people have documented, starting from deep vein thrombosis to the multiple type of problems actually one can land up. Coming to testosterone, beard and body hair growth, male pattern baldness, clitoromegaly, heightened libido. These are all the things that will actually come out when actually you try to use. The side effects are many, polycythemia and increased hematocrit values, nausea, vomiting, abdominal pain, headaches. In fact, the problems could be many, including the risk for cardiovascular and such other things, gynecological, in fact, endometrial hyperplasia, aggression, exacerbation of obstructive sleep apnea, and you name, but majority of such things are common. Trans women, laser hair removal, surgical treatments, and so many other such things people have suggested. Men who are attracted to trans women who get attracted to men who have undergone such particular changes. These are all few of the things actually people have documented. Gender realignment surgery, I'll not go into the details because there are experts who deal with these things in a much bigger fashion and a better fashion. Assessment of eligibility, psychiatric opinion. Not all transsexual people want or can proceed with genital surgery. Not a vital aspect of gender transition, often seen as an endpoint in research, which is not helpful. Important points. Many patients find comfortable, effective ways of living that do not involve all components. Some individuals cannot have some physical treatments. Not every patient requires psychotherapy. Other models of care exist. Transgender care in certain countries, there is a whole lot of emphasis on that. Sex reassignment surgery criteria, I will not go into too many details, except that 2 references are minimum necessary. Persistent, well-documented gender dysphoria, informed consent, age of the individual, 12 continuous months of hormone therapy, and 12 continuous months living in the desired gender role. In fact, these are the 2 things which actually people consider important. It allows a trans person to change their legal birth gender and other related to these things because a whole lot of issues related to that. I'll not go into the details unless some questions come up. Change of the law, what was actually happening in the West, there are certain things are there. And what we talk about, coming to the Indian, this thing, it is based on British-made Section 370 in 1860, which criminalized the homosex between 2 adults. After independence, like many other laws, this law has also blindly copied into the Constitution. There are so many legal issues, challenges related to Section 377. The NAS Foundation, which went to High Court of Delhi, struck down much of S377, but unfortunately, this was reversed again. This is about the time we wrote about one of the editorial. What was done earlier good, it was actually not good because In fact, homosexuality was considered as one of the criminal point. Even today, even very educated individuals, even medical professionals in a first, 2 trans women doctors get government jobs as OGH medical officers. They fought and won it. But many people, still the society doesn't accept many of these things. Indian Supreme Court issues landmark ruling for LGBT equality by actually recognizing that there is a third sex. And this means actually what actually tried to modify the mistake what was there in the beginning. World Psychiatric Association and the World Association of Sexology, in fact, they have come out with a range of rights that every individual has. Sexual rights are those minimum standards that are required for a person to experience and express their sexuality in a positive manner. They can only be realized and enjoyed in an environment that is free of discrimination, coercion, and violence. What are those rights? Seek, receive, and impart information related to sexuality. Sexuality education. Respect for body integrity. Choosing partner. Sexually active or not. Sexual relations. Marriage. Whether or not to have children. Highest attainable standard of sexual health, and pursue the satisfying, safe, and pleasurable sexual life. These are all actually the vast this thing. And in one of the interviews, I had spoken about why and how, in fact, this aspect is extremely important for everybody, starting from you gynecologists to we psychiatrists to almost all specialists. There are few things which happen. Just to end my lecture, there are 1 or 2 small videos just to document to you. One should be almost always keep a watch on gender issues actually changing time to time and creating a whole lot of difficulties and problems.
Come here. Chúng ta đâu mà có về. Cái đó thì mà được không? Được lắm, quá xỉu quá. Gì?
你没事吧？
我没事，你他妈谁啊？
亲爱的，我们继续吧。
不要。
The confusion can be quite significant in such a situation.
Marido.
World is changing, and one should be well aware of a whole lot of issues. What is actually necessary is actually an integrated approach to understand the sex, gender, in fact, concepts related to this is so wide and important. Not everything that is faced can be changed, but nothing can be changed until it is faced. And we are all going to face a whole lot of issues related to this. There are some questions. Okay. Thank you very, very much. And I'll stop my presentation at this level.
Thank you very much, sir. It was such a mind-blowing, because we will have to so many confusion about this gender terminology. You make that very simple and understandable. So, sir, still I have one confusion. Transgender and transsex, both are same or they are different?
When you use the word sex, you are talking about the genital sex and such as a terminology. Gender is a little broader term where range of social norms and behaviors and all are actually included. It is only the extent to which it is. If you bring in social issues, we use the term transgender. Transsexual refers to, in fact, this is one of the word terminology. Now we are not using that particular terminology at all. Here we are referring to what individual, that means the phenotypical, genotypical, and whole other such aspects, and wants change.
Okay.
It is only the extent of concept.
And in sometimes in adolescence, yes, who is speaking? Yeah, in sometimes adolescent period, it can be transient phase also about the gender dysphoria. Or
Absolutely. In fact, this is one of the reasons why, see, in children and adolescents, there is one particular group is there. Now people are recognizing this particular concept being present in the very early age also. But a lot of people will outgrow this particular concept and settle down. They continue to see, for example, there are two concepts. One is actually identity, what I am, to what I am get attracted. So whole lot of permutation combinations can happen in this particular thing. The important point here is actually, in fact, once recognized, but nowadays the parents bring them, in fact, you do something to see that he changes and whole lot of these things. Now, according to the law, doing anything from that angle is actually problematic. Now the whole question is counseling the parents to make them understand that this is actually normal for all practical purposes, and this is not possible to change that. All coercive and other such particular methodologies of either behavioral, physical, or drug-related treatments, nothing positive has turned out.
So unless individual become adult, you can't label them as a transsexual or transgender.
See,
right?
The minimum this particular thing should be present for at least 2 years.
Okay. No,
of,
it's not required that they should be more than 18 years. Even before 18 years, they can be labeled as a transgender or transsex.
Children and adolescents, in fact, there is a whole category. See, for example, identity is established by 3rd year. This is what actually the science says. But 4th year, 5th year, 6th year, in fact, the whole lot of things can happen. One may change. One may persist with that. That particular thing may grow significantly. All permutation combinations are possible. It can happen from the very early age, actually.
So suppose 10-year child comes thinking this, he or she is the transgender. So how will you?
One of the treatment techniques, what are the things we can do at what age? That is the question which arises.
Yes.
We almost always suggest the child to continue with certain activities which are non-sexual, getting engaged either with the studies, sports, various other activities and all of that, and wait for some time. The idea is
1 year, 2 years, or is there any specific limit or?
Of course, still the whole concept is not so clear, but all said and done, we don't think of what we call as irreversible and such other major treatment procedures for young individuals.
Okay.
We almost always ask them to experiment and see how far, in fact, this particular idea is strong in them.
Mama, Apurva, is there any question? Anyone want to ask anything? It's open. You can ask.
Apurva
sir, I have.
Apurva, you are
Yes, sir.
You won the election?
Yes, sir.
Oh,
he won
yes, sir. Thank you. Thank
Actually,
you so much, sir. From all the blessings from Neeraj, sir, you and all the seniors. Yeah, sir.
From January to 2024, he will be the chairperson.
Oh, good.
But Neeraj sir will be the super chairperson. Definitely. I always need his help.
Yes, sir. What about?
Sir, Neeraj, yeah. I have actually I have one patient. So what about, he's a young, I think 24, 25-year male, and he is living, he's a military man. So he used to live in the barrack, in the military barrack, and there he's some same sex, something like that happened with him. So he come to me and he was so much confused that what actually his own gender identity. whether he's a straight or whether he's something like that. So these type of things are, I think, a really very much confusing to all the peoples, and they are really confused. So, sir, I just want to ask from you, when these type of patients are coming, so what should ideally we advise them? What should be the line of counseling so that we can, clear their doubts?
See, the one is, that's what actually you were trying to tell in the beginning. There is something called as, lack of opportunity or availability of opportunity. In fact, one can go to an other extreme. Virtue is nothing but lack of opportunities. You got the point. We are all trying to be, in fact, go after pleasure. And this particular pleasure can be so many ways. One may drink alcohol, another person may take opioids, another person may enjoy sex. So, in fact, all the brain structures are almost same. See, the army, take an example, there is no female available, only males who are there. And there was actually something happened, and it was giving pleasure. He was a very active person or passive person. He participated, and he felt happy and continued for some time. That doesn't become actually the identity of an individual. Second point, whether he is attracted to that person or not, we are not sure at that particular level at all to come to the conclusion. So the second point is, if he believes that he is not getting any interest in the opposite sex individual, and the whole interest is actually the men only, in fact, that's where the question arises, whether he is actually having problem in this particular area. Third point, he is very anxious individual. He is feeling incompetent or, in fact, inferiority complex, and you name so many other such terminologies. See, for example, to go after a girl, to win her and all actually needs extraordinary capacity. It is not easy. But to deal with the same with a boy is much easier. So many people may get stuck with that because it is actually something easy. And this is one of the reasons why many people enjoy masturbation much. See, masturbation is easiest method of sexual release. Sex with the same sex individual is the second little more extra. Sex with an opposite sex individual calls for so much of this thing. Extraordinary capacity. See, one of the jokes, I'll tell you a small joke. There was one African and one American, one Italian. Have you heard this joke?
No. Yes, sir. Go ahead.
The Italian says, when I have sex with my girlfriend, I spend about 1,200 calories. American says, oh, when I have sex with the girl, I have 1,500 calories. The African says, I spend almost 1,800 calories. That the Indian says, to make her agree, I spend 2,000 calories. You got the point? They're all different level of anxiety generating situations. Say, easiest way is actually masturbation, having sex with the same sex individual, having sex with a child, having sex with an animal, having sex with something. In fact, these are all easy methods. See, some people, he got the pleasure out of it and he may continue it. In fact, this is what positive reinforcement and negative reinforcement we talk about. Certain behaviors are reinforced because it is easy. And one of the most difficult thing what people have documented is actually the winning the opposite sex individual. This is what women find it, men find it. In fact, when we are talking about in a normal heterosexual this thing, that's one of the most difficult area. So very difficult to answer at that level. He has to wait for some time, understand himself, and what one can counsel is not to get perturbed with this particular area. Let him carry out the regular activities and all of that. And whether somebody gets interest in the opposite sex individual or not, there are a lot many other things actually happen in life which will teach him understand what actually he is. Don't be very aggressive. This is one of the suggestions always made. Fourth point actually related to your question. See, we had one of the patients we presented in one of the academic societies some time back. When he used to get into what we call depressive phase, he used to come out with the whole range of what we call homosexual, such other behaviors. When he gets into a little hypomanic and manic phase, in fact, no such ideas at all related to. It was one of the manifestations of what we call bipolar disorder. No, you got the point. That's why for any irreversible procedures to be done, 2 psychiatric opinions are necessary. And say, for example, WPATH talks about certain months. Earlier, people used to talk about 1 month, 3 months, 6 months, and all of that. At least about a year, they should go through, and then they feel there is no other alternative they want to insist on. Then only certain irreversible procedures need to be carried out.
So, sir, LGBTQ is a basically sexual orientation issue. No?
Yes, that is true.
So, gender dysphoria is a umbrella term, or what is?
See, the gender is a broad term which involves behavior. Yes. And if some particular behavior is producing distress in me, that newer terminology that has come is gender dysphoria.
Okay.
Otherwise, I feel I like, say, for example, I feel I am a man, I feel I am a woman, I feel something. That is one aspect of it, that identity. I get attracted to that boy, I get attracted to that lady, I get attracted to that this thing. No, you got the point. I get attracted to both men and women. I get more attracted to the men. I get more attracted to the women. Bisexuality. In fact, there's another terminology related to that.
So I have a question. One of our patients, he is an 18-year-old boy. At the very young age, he developed attraction towards boys, and he had many affairs, and they were like monetarily enjoying his money and just leaving him alone. And one fine day, he decided to change his genitals as well, to have a sex change operation. He heard somewhere that it will be happening in Mumbai. He left home and he went to Mumbai, and he spent many years like a girl and dressing like a girl. And after he came to know from some friend that his mother has fallen sick because of him, she is very much remembering him. Then he came back to his place, and now he came with his elder brother to our hospital with 2 sides of coin. Like if he could change, if we could treat him to change his behavior or something, and or if he continues, like what he can go ahead with it. So we have done every investigation. He was a normal male, genitals and also karyotype was normal, everything was normal, and he was sitting very quietly, and when I was asking questions, he was seeing in my eyes. But when the male doctor, when he was saying, he was not able to see in his eyes. Why you are uncomfortable means I'm very much hypersexual, means every time when I'm very close to any male, I'm getting a lot of feelings, a lot of emotions. I'm not able to concentrate like that. He's having a hypersexuality towards the same gender. So we were really confused, but as he is having a hypersexuality and he is 18 years, we have suggested them to have a proper counseling time to time with a psychiatrist, and also to look for some proper sites where same gender are meeting in one place, like positive thing. I don't want him to just wander in such a place where he will be exploited. But as he is 18 years, I suggested like that. But what you will suggest in this case?
Okay. See, there are a lot of concepts now. We don't agree with some of the terms what you have used straight away. What it means is, take an example, he is hypersexual. Okay. That whole concept is actually in confusion. Sexual addiction disorder means there are few points people have suggested, but in this particular individual, we cannot say he is hypersexual for the simple reason that, see, for example, people interpret I get sexual feelings, that itself is too much and it is actually bad, and why I'm getting attracted to the male. No, you got the point? So better to avoid those type of value added, what you call value loaded terminology. That is one aspect of it. That is one. The second one, you must make him understand and clear that the type of feelings what he has and all of that, that is actually nothing abnormal. Get him actually out of the anxiety. because parents are insisting or mother wanted him to be in a different fashion and all of that, it is not necessarily going to work that particular way. Second point. That means try to reduce his anxiety as much as possible. Third one, if he wants to explore his whole life in that particular homosexual this thing, absolutely there is no reason actually he should be upset about. But one should avoid risks which are associated with certain, as you yourself very clearly mentioned, they are all absolutely beautiful ideas. The fourth one, people believe that sex and surgery can bring about wonderful changes in individual's life. In fact, so many complications people have reported, and so many failed sexual surgeries are actually documented, and then subsequently feeling regretful and all of that, they're all there. So it is fine. Sex and surgery, if wants means, it is possible. But all said and done, not to jump to the conclusion immediately like that. The fifth one, what society believes, what the mother and other related things, in fact, you have to explain to them, counsel them actually to see that, in fact, they don't put too much of pressure and actually make him agree for this thing. And this is one of the reasons why many people marry. Then subsequently, they are not able to perform. Many people marry, they are not able to consummate marriage. Many people marry and in no time it gets into the difficulties and relationship issues and all, some of those type of things crop up. So better to avoid those type of things. Don't force him, because to experiment it, let us marry him. Marriage is not something very easy. Relationship is a little different. Getting married and a whole lot of consequences that actually may come up. These are all quite a few families end up with some difficulties. So as far as this stands now, counseling the individual to make him comfortable, counseling the relatives to not to put pressure or coerce in some particular way. The third point is explain to him all the issues that are involved with that particular decision what he is making.
Okay. Thank you, sir.
Anyone wants to ask anything? It's open for everyone. I think so. There is no question anymore.
I think this is my shortest presentation.
Yes.
What happens, sir, when Neeraj sir told me that we are going to choose this particular topic, I was really confused that what it will include and what it will include, so that there is a 1.5 hour lecture for this particular topic.
And for example, if I have to elaborate on, see, for example, LGBTQ, there are a lot of words.
Yeah, absolutely, absolutely, sir.
There is a separate chapter on its own right.
Okay. Absolutely, absolutely, sir.
So
you, sir, beautifully, at least, sir, for us, those who are practicing sexologist or the gynecologist, it's really a eye-opener lecture.
The message
for
is
all
only
of
this
us.
much, that we should be sensitive to this particular idea.
To particular idea.
Are like us, and there is permutation combinations possible in one's life, and one should be able to recognize, help them to the extent possible.
Thank you very much, sir. So clearing our so many confusion about this different terminology. So now, Apurva, we can go ahead with the vote of thanks.
Yeah. After really this an eye-opening lecture for all of us, so it's the time to say goodbye. And before that, it's a time for the vote of thanks. So I would like to thank our dynamic Foxy President, Dr. Rishikesh Pai sir, Secretary General, Dr. Madhuri Patel, Madam, Vice President in charge, Dr. Asha Bakshi, Madam, our own chairperson, a person behind all this program, Dr. Neeraj Jadhav, sir, the today's guest, chief guest for today, Prakash Trivedi, sir, guest of honor, Dr. Usha Sharma, ma'am, and Dr. Revati, ma'am, for graces this project. I would like to thank the person who is behind all this, our own very own faculty, Dr. TSS Rao, sir, to always there and always accept our invitation and give this such a wonderful and eye-opening lecture for all of us. So thank you, sir. Thank you so much. I would like to thanks to ICOG chairperson, Dr. Lakshmi Srikhande, madam, and the secretary of the ICOG, Dr. Ashok Kumar, sir, for giving us the ICOG credit point. And I would like to thanks to my co-host, Dr. Tama Sultana, for beautifully moderating this along with me. Thank you. Thank you so much to all the audience for their patience hearing and patience learning. Thank you. Thank you so much. And sir, yeah, Medisec, thank you so much. Medisec, Akash, Riddhi and all for providing and for giving this in the online in their sites, and so that it's reached to each length and breadth of the corner of this country. So thank you so much to each and everyone. Thank you.
Just before closing, say for example, hypersexuality, hyposexuality, sexual addiction disorder, that is one another different area altogether. Everybody gets confused in that particular aspect. That is one. Paraphilias are something other abnormalities. Now we classify them as paraphilic behaviors. Problematic, but not much to the society in general. There are some problems which actually can create difficulties. Say, for example, can lead the individual to going against societal norms, or going against certain things and all that. So gender, I could have now looking at it, if I had just brought that particular area, that would become another major presentation.
Presentation, absolutely.
Yeah, we will cover that hypersexuality in next one.
Definitely, sir.
Thank you, sir.